But first, the government set a target to offer a first vaccine to all over 70s, NHS and care workers and care home residents by tomorrow. So, will they meet that target? Well, let's ask a man who should hopefully know, the Foreign Secretary Dominic Raab. Thank you for being on the programme this morning.
Good morning.
So the government's target is to vaccinate the top 4 priority groups by tomorrow. Are you going to meet the target?
Well, there's been huge progress made and we're confident we're on track to do so. We'll obviously get the final data later on today and tomorrow. And it will be a really important milestone because that's the top 4 priority groups that have been offered the first dose. And it is the, if you like, the first milestone towards the wider plan to get 99% of those at risk of dying vaccinated with the first dose by the end of April. And then everyone in the country, every adult in the country offered a first dose by the autumn, and that's part of the roadmaps. So the NHS teams, I was down at my local vaccination centre in Walton, the volunteers there, Nadeem Zahawi, Matt Hancock have done a great job. But of course, this is only the first step in the vaccination rollout. It's going well, but we've got to keep it up.
You must know if you're going to meet the target by tomorrow. Are you just leaving it for your boss to announce?
Well, I'm confident we're on track to do so. The numbers look good, but I want to wait until we've got the formally published figures so that we're doing it accurately and in the right way. So I can't quite jump the gun, but I can tell you that we're on track and we're confident that we will meet that target. And of course, the target was come Monday, so come tomorrow. So you'll get the full data then, but it's a really important first step in the vaccine rollout. And we then evaluate all of the data, and the Prime Minister on the 22nd of February, so Monday week, will set out the plans going forward, because of course we understand people want to know a bit more what the next stage will involve. They want that light at the end of the tunnel, and it's right that we do it this way based on the evidence, and so far the evidence is positive.
Pretty clear that you're confident the vaccine rollout is going well so far. Now, on Friday, the Prime Minister is going to be hosting this virtual G7 meeting. He's going to call for further international cooperation on vaccine distribution, saying that governments have a responsibility to work together to put those vaccines to the best possible use. So does that mean that we are planning to give some of our vaccines to other countries? And if so, when would we do that? At what point would we do that? And who would we prioritise?
Of course, we're not going to do anything that would undermine the integrity of the domestic rollout. That would be counterproductive. And it's fair to say we have already contributed on the international track. So these aren't binary choices. We've contributed over £500 million. That will secure over 1 billion doses through what's called the COVAX AMC facility. So we're already
just to jump in, sorry, you say that you wouldn't do anything to undermine the domestic rollout. So what does that actually mean? Does that mean you're not going to give any vaccines away until every adult in the UK's received their first dose? What does that mean?
Well, so first of all, we are already supporting and indeed leading the way with our G7 presidency of the international approach. We've contributed enough money to produce 1 billion of those doses. And what we want to do is, having led the way, encourage and cajole and use our convening power to get other countries to match that. That's the way we deal with the global challenge that we all face. I think the answer to your question is, would we use any surplus vaccines from the 450 million doses that we've got for the domestic rollout? We'd need to, before we start looking at that, we'll need to know with confidence that we're able to roll out reliably according to the timescales that we've got. So, but these things go in parallel. We're leading the way, I think, domestically with our rollout, but also internationally. And so what the Prime Minister is doing is making sure with that strong example that we're setting, we can also encourage others to make sure that the vulnerable countries, the poorest countries around the world, are also able to benefit from equitable distribution of the vaccine. We need a global solution to what is a global pandemic.
OK, now let's talk a bit about the light at the end of the tunnel that you mentioned. Cases are dropping. It seems like you're on course to meet the targets tomorrow on vaccines. Now, the government wants to reopen schools from the 8th of March. What I want to know is, are you planning on reopening all schools to all pupils at the same time, or are you considering a staggered approach where, for example, primary schools might go back first, or some pupils in exam year groups might go back first?
Yes, no, it's a good question, and I know there'll be many teachers and parents that want to know those answers, which is why, with the approach we've taken, we've always said that on the 22nd of February, so Monday week, the Prime Minister will review all the evidence, the impact of the lockdown, the impact of the vaccine on the transmission rate and the number of people going into hospitals with coronavirus. We'll then set out the forward look. But you're absolutely right, on the 8th of March, we are hoping to get schools back. The precise details we need to just make sure we set out once we've evaluated all of that evidence. So the Prime Minister will give more of a steer on the 22nd, but the aim is to get schools reopening in a responsible way on the 8th.
So is the answer then, you haven't decided yet whether that's going to be all schools or some schools? That's dependent on the data.
Yeah, I think we need to wait to evaluate the data carefully and allow those plans to be put in place. And of course, the consultation goes into them because I know that's important for the stakeholders, for the schools and others. And then the Prime Minister on Monday week will be able to set out the full detail. But because we're making progress, I think we can feel confident that we will be able to start that process of getting schools open on the 8th. And of course, there'll be other measures that the Prime Minister will want to set out. But it'll be based on the evidence and the success that we've had in terms of rolling out the vaccine and the impact that has, not just on reducing the number of cases, but also reducing the pressure on the NHS.
OK. Now, the Sunday Times and the Sunday Telegraph are both reporting that at the same time, there could be some minor relaxation of other rules. The government could announce, they say, that adults will be allowed to sit down outside on a park bench with one friend. So is it really against the rules right now for you to sit down on a park bench with one other person? Is Matt Hancock going to be, patrolling parks and slapping you with a 10-year jail sentence if he finds you?
You're not going to get a 10-year jail sentence for a minor mistake on a park bench, but it is absolutely right that until we change the rules, we need full compliance, because that's the way we make the progress that I've described. I can't tell you all the changes that will be made because that's the point of having this review point on the 22nd of February. But what our priority will be is schools, as I mentioned. I think also it's fair to say getting non-essential retail open is going to be very important. And we also, you mentioned things like the ability to socialise with people outside. These things are quality of life issues. They really matter. So they're not small things. We understand that. I appreciate that. I'm sure everyone watching the show does. But we do need to be very careful in how we proceed. We've made good progress. We don't want to see that unravel because we go too far, too quick.
As you say, these aren't small things, and there is a serious point to the question. If you're elderly or if you're pregnant, going for a walk, your piece of exercise with one person from another household, which is legal, and if you sit down on a park bench for a moment, is that unlawful? Are you breaking the rules?
Well, I think the rules are pretty clear. That the idea is not to have people socialising, but to follow the very clear guidance for outdoor activity, which is...
But can you sit down on a park bench?
To maintain, but it all depends on the context. And in truth, of course, the media will pick up on the odd story here and there. But the police have done an incredible job in applying rigour, but also some common sense. So no one wants to pick up people that inadvertently find themselves for a split second in the wrong place. What we do want to make sure is people aren't flouting the rules. That is how we get back control of the virus. That's what we have, the data shows that we're achieving. We don't want to see that unravelling. So it is important. But I think we can trust the police in their interactions with the public to get that balance right. Overwhelmingly, they have over the course of this pandemic.
OK. Now, a group of your Conservative colleagues have written to the Prime Minister. They say there's no justification for any restrictions to remain beyond the end of April, because by then, all 9 priority groups should have been given a vaccine dose. And those groups, of course, represent 99% of COVID deaths, around 80% of hospitalisations. Are they wrong?
Well, that's our aim. That's the roadmap, to get 99% of those who are at risk of dying from this awful virus.
What, the roadmap to ease all restrictions by the end of April? That's not the plan, though, is it?
No, you're putting words in my mouth. The plan is to get the 99% of people at risk of dying dispense their first dose by the end of April, certainly offered their first dose. And by doing so and taking the fatality out of this virus, we are in a much better position to proceed to start to ease the lockdown. And we've just talked about the way we're going to do it, starting with schools, non-essential retail. I don't think you can set, though, an arbitrary target and not be evidence-led, which is why the review point on the 22nd of February is so important. We can see the success we've made. And as you rightly point out, we look on course to hit the first milestone tomorrow. Then there is, by the end of April, to have a further 70 million people offered their first dose, and we want every adult offered their first dose by September. That's the roadmap we've set out. We need to be evidence-based in analysing our progress towards it.
But they're saying that if those people are vaccinated, all 9 priority groups, then restrictions should end. Do you agree with that or not?
We're not taking what feels to me slightly arbitrary commitment without reviewing the impact the measures have had on the transmission and the hospital admissions of the virus. So in that sense, we're making sure that as we go and we take the steps both on the vaccine, but then in due course, as we open up schools, of course, we want to see what impact that has on the virus. And we need to retain some flexibility to deal with the variants, which of course are part and parcel of dealing with the pandemic, but do alter the precise time frame. So we'll be evidence-led, but we share the ambition to get out of lockdown, to transition to a better place for economic reasons, for jobs, for livelihoods, for the most vulnerable in our society and for everyone's mental health.
And Professor Neil Ferguson this week of Imperial College told me that some low-level restrictions, face mask wearing, could even go into next year. Do you think that's realistic?
Well, I just don't want to jump the gun on the series of measures that the Prime Minister will announce and the roadmap.
Okay.
All of these things will be looked at in the round.
OK. Now, from tomorrow, arrivals from certain countries will have to go into hotel quarantine. So how many hotels are currently signed up and how many rooms has the government booked?
Oh, I don't know the precise number of rooms booked, but you're right to say there are 33 countries in the high risk, the red list, if you like, particularly from South America and from Africa. And in relation to British nationals coming home, so you wouldn't be able to, if you're a foreign national coming from those countries, you wouldn't be able to come back. There's a bar on entry into the UK. But if you're a British national or resident trying to get back home, we will have a system of government-commissioned hotel-based quarantine for the 10 days, subject to 2 tests, and a lot of preparation has gone into that to make sure. And it's only one additional measure, if you like, one extra safeguard in the lines of defence that we've got against new variants coming in. But I do think it's significant and important on top of the other border-based restrictions we've now put in place.
The Times reported yesterday that so far only 16 hotels have signed up, none of them north of Birmingham, and that we could run out of rooms by Thursday because there's only 5,000 booked and we're expecting 1,400 arrivals a day. So I understand you're probably not across the detail of exactly how many rooms, but are we going to have enough?
I think we will. And of course, I mean, the truth is the travel has largely dried up in any event. But what this measure allows is
1,400 arrivals a day is quite a lot still, isn't it?
Nowhere near comparison to the kind of travel. I mean, if you look at Heathrow Airport or any of our airports, they're empty compared to what we've seen previously. But what we do need to make sure we've got is a safe, reliable, workable system for UK nationals from those 33 high-risk countries, so that we don't find unwittingly or otherwise, that the progress made in terms of the vaccine and control of the virus is undermined. And those plans are now being properly implemented. We've taken our time to get them right, and we'll be able to deliver them from Monday. You
talked there about 33 countries being on the red list, but of course there are other countries where the South Africa variant, the variant of concern, has been found. Austria, for example, the Austrian region of Tyrol went into lockdown on Tuesday after 293 cases of the South Africa variant were concerned. Austria isn't on the list. Isn't it not time to have a blanket ban?
I'm not sure that's proportionate. And of course, having blanket bans on any, for example, air travel into the UK would be very difficult for the supply chains, things like freight, which sometimes come in the
But you can exempt freight. You can exempt freight, can't you? That's what France has done.
Well, look, there are different ways of looking at it. We assess the data very carefully. So whenever there is an outbreak or a deterioration in one or other country, we look at it very carefully. And what we want to make sure is we've got as targeted measure as possible to keep those supply chains open, to make sure British nationals or residents can come back from abroad, but also to avoid undermining the progress we've made. And we think we've got the right balance, robust measures, but targeted measures.
OK, do we know how many cases of the South Africa variant there are currently in the UK?
I don't have that data. I'm not sure it's ascertainable. And of course, people refer to it as the South African variant. Actually, the South Africans have a bit more advanced than many other countries in the genomic testing. So the question is where the variant first is tracked. And we've, of course, had a similar issue. We're world leaders in genomic testing, and we're very transparent about things. Like the South Africans, the truth is these variants, as in the course of any pandemic and any virus, happen. And the point is that we've got the measures in place, the tracking, the expertise in genomic sequencing, and the international collaboration, the cooperation we have with countries around the world to make sure we can track it very carefully and take proportionate measures.
Now, I just want to finish by asking you about Anne Secoulis, the American woman involved in the 2019 crash that killed the teenager Harry Dunn. Now, she claimed diplomatic immunity, returned to the US. They've since refused to extradite her. Now, 10 days ago, her barrister told a US court that she was employed by an intelligence agency in the US at the time of the crash, which was especially a factor in her departure from the UK. Now, this matters because if she was employed herself, she wouldn't have had diplomatic immunity. So when did you or the Prime Minister first become aware that Anne Secoulis was employed by an intelligence agency at the time of the crash?
Yeah, well, look, first of all, we don't comment on intelligence matters, but what I can tell you categorically, because it's not quite right what you've said, is at the time that Anne Secoulis was in the UK, and the basis of her immunity was as the partner of an officer at the embassy. And that was the basis for it. And we obviously sought waiver of immunity, and we've sought her return under extradition, and we continue to do so. And of course, I've raised it with the new US Secretary of State. We want to see justice for the family of Harry Dunn, and we do believe that Anne Secoulis should return. So,
did the US not tell you that she was employed by the US intelligence agencies at the time of the crash, as her lawyer has said?
Well, Sophie, as I said, first of all, we don't comment on intelligence matters, but what I can tell you categorically is that her status was as the partner, the spouse of an officer of the embassy, and that was the way both the US with us and approached things and the way we did. And the other speculation had no impact and wouldn't have had any effect on the status that she had in the UK.
So you know it now. We all know it now because it's been widely reported. When did you first find out that she was employed by the US intelligence services?
So, Sophie, you can ask me the question as many times as you like. I don't comment and pass comment on intelligence matters at all. But what I can say categorically, and we've been clear with the family as well about this, is that her status was very clear, and it was based on her being the wife of an officer of the embassy up at Croughton. So that was the basis on which she had immunity. We, of course, wanted it waived. We, of course, wanted her to be returned after she'd left, and that remains our position.
So can you guarantee that you didn't know that she was employed by an intelligence agency before she left for the US?
Sophie, I can guarantee that I don't comment on intelligence matters, as many times as you wish to ask me.
OK. Dominic Raab, thank you for coming on the programme today. Much appreciated.
Good to talk to you.